Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me to cut through the fog that exists at the leading edge of healthcare technology. Searching for beneficial disruption in healthcare from emerging technologies, that is our mission. My guest today is Mr. Charles Aunger. Charles is a CTO and advisory board member to Health2047. He has served as a senior executive director of IT at Stanford Health Care. He was a senior vice president at the Cleveland Clinic in Abu Dhabi. Charles, welcome to the Tate Chronicles.
Thanks, Jim. Thank you very much for having me. Appreciate it.
Yeah, appreciate you giving us some time for your some comments and perspectives. First of all, tell me a little bit about Health2047. What's going on there?
Absolutely. So Health2047 is the Silicon Valley innovation arm of the American Medical Association. We were set up a couple of years ago, 3 years ago now, by Dr. Jim Tate, who's the CEO of the American Medical Association. And they did a study internally about what was going to be the next 100-plus years of healthcare. And that 100-plus years was about how the AMA up to that point had been looking after healthcare in the United States. And what was one of the biggest things that came out of that report was technology, as we know today, was going to be a big changer. And so they did a study, they figured out where they needed to put this, and they thought Silicon Valley was a good place to stick this organization called Health2047 Inc. And invest a chunk of money and basically stand up this organization. So we're a group of individuals from a very much wide depth of healthcare and technology background that looks at how we create commercialized technology projects that are disruptive to the $3.4 trillion market within the United States healthcare.
Well, yeah, I read a little bit about the organization, and it sounds like it's initially focused on 4 different problem areas: data liquidity, chronic care, radical productivity, and healthcare value. If you don't mind, let's kind of unpack each one of those a little bit. Now, there's no doubt that data liquidity, and let me maybe put words in your mouth. Are we talking about interoperability there with data liquidity? Is that what we're talking about?
So I think that's a really good one, Jim. I think fundamentally we created these strategic problem arcs that aligned to some of the missions that the AMA was looking at. And what we found was that the main 4, as you were saying, were data liquidity, chronic care, rapid productivity, and healthcare value. And the issue with all of these is they mean different things to different people. And I think that's a big issue that we had in the healthcare and technology industry. We use tech words to disseminate information when it doesn't mean the same to somebody in the world at large. So what we tried to do is create these ARC names that meant more than just what it was supposed to be. Interoperability is one problem with data liquidity. We have lots of other issues that are out there. One is that we have data hoarders today, right? We block and tackle data movement not just at an interoperability level, but even the simplest things, like we still use faxes. We have approximately 3 million people in the United States that still have dial-up internet access. And carry around, you go and have your MRI scan and they want to give you it on a DVD. How do you use that DVD in most PCs today? Right? They don't come with a DVD player anymore. So what we looked at was think of an AMA mission and think of a company that's thinking out past the simplistic piece and say, okay, what have we got issues here? And one was we're missing data models, right? We're missing real-time, industry standard data models. So the AMA and Health2047 have been looking at a product, and you've probably seen it, called IHMI, Integrated Health Model, which is around data models, yeah? Second one is, what about data security, right? So aggregating data security. So we started working and did some work on security standards, which the AMA started pumping out. What about mobile technology? If the world's moving into mobile, how do you bridge the gap between mobile and data? So we look at more than just data interoperability, and we created we spun out one of our first investments called Akiri, that I was been looking at for the last 10 years and co-founded and CTO of that organization at the minute whilst we completely stand it up. And that was, how do we do the basics of digital rights management? So if we even could get interoperability, which we're working to, and we've got some ideas around that and working with some really interesting partners. What about how do you move the data? How do you protect the rights of the data? How do you make that user-centric and physician-centric? And how do you take it away from a bunch of techies in the background? And so the shift that's happened in the internet world has been, we've empowered people to make decisions, and data in healthcare doesn't empower people to make decisions right now, and that's what we've been pushing.
I see. So it's really getting data in a position so that good decisions can be based on that data. Absolutely.
Yeah. Data, you've got to do the movement. You've got to figure out how you aggregate it. You've got to figure out how you're going to use it. If you don't know what you're going to use it for, interoperability doesn't really help in a lot of ways. But, you don't have to go and get all the data all the time. We don't do that with websites, right? We go and we have this snackification of what information we need at what time. And the old school method was move all the data all the time. And how we see healthcare is kind of like what the finance industry was 15, 17 years ago. They spent a lot of time building big monolithic data systems and moving data around, and they don't do that anymore. And so that's going to be an absolute radical change. If we can push standards and push people to move towards freeing up data in a lot more ways and give technology out to help do that, some of the other arcs will benefit from it.
That's a good segue. Using data or getting data ready so that decisions can be made on top of it for better outcomes. That kind of takes us over to the chronic care. And so we know what a giant chunk of healthcare, the healthcare financial pie goes to chronic care. And whether it's diabetes or congestive heart failure or something along those lines, what is the focus that Health2047 is doing in the chronic care space? Is just appropriate use of technologies to track and keep people within normal limits? What's that about?
I think everybody's tried to. So we work with, obviously with our AMA partners, we work with people like the CDC and Samsung and other people to really try and change the dial of how we use some technology here. And, you see maybe 20 or 30 companies on a monthly basis start talking about diabetes and chronic care and other things. You've seen with the ACRC, last week, the Association of Cancer Research Companies, in Chicago do their model that says, cancer is now becoming a chronic disease, right? And we're going to treat it like that. But what you've got to be able to do is show the history of what you're doing, so you have less adverse effects, you have more history of how the drugs are working with you. So we're looking at technologies. We're doing mobile technologies. We're doing even strategies around thinking about how we do care evaluations and analysis, because when you look at the figures, it's pretty outstanding, right? About 133 million Americans really have some sort of chronic care issue, and that's about 40% of the population, even myself, right? So I got a care issue about 8 weeks ago, and it could have had pretty nasty side effects and pretty nasty consequences, but it's been treated as a chronic care issue, and I just get treatment, and I communicate with my doctor through texting in a different secured manner, and I can look at my appointments, and I can talk to the foundation through a tool that we're working with. And that makes a huge difference because I feel connected. And what's happened in chronic care is it's more around how does your support mechanisms help you with how you look at what's needing to happen. And it's been across everything. You know, if you've got a situation, you just want information given to you, and transparency is a really big thing. And what we think is working with, like I said, CDC and others, we found some of their biggest issues is getting data feedback. Have the people turned up to events or cases, information, etc. And we found the YMCA has some of the best diabetes results, DPP program results of anybody. However, how do you get the information out that it's there?
Sure.
And the CDC wants to prove how. So that's what we've been doing, and a lot of it's around data communication and gathering that.
Yeah. And hear you speak, Charles. It reminds me of a quote from Mark Twain. He said the secret to living a long life was to get a chronic disease and then manage it well.
Absolutely.
Which just means you just got to take care of everything. You pay attention to yourself and you monitor things. That seems to be. Let's hop to this next category because we want to cover them all somewhat. I was struck by the two words, radical productivity. Now, that makes me think you've got a chicken, you want it to lay 4 eggs a day. What is radical productivity?
Radical productivity, right? We talk about AI all day, and people are blown away with what AI can do in when you think about Facebook and other things. What if we really can harness the technology and do changes to environments and kind of like put the Uberitization into healthcare, right? What if I could interface with doctors and patients from angles that you've never thought about? How can I get payment systems to really be intuitive? And we have one of our members of the team used to be the co-founder of Siri, right? And we're looking at what about all of the aspects. Siri was never based around being a dictation tool. It was based around getting feedback and actually actioning a task versus just saying, can you tell me the direction system, where it was about, you could sit there and say, order me a pepperoni pizza and it'll figure it out, right? So we've really taken the idea of what we have today is a lot of not AI, but IA, augmentation about information analysis, and we just augment what's going on. And we have so many issues around payment systems and billing and how that technology is harnessed and not nicely connected between different platforms inside the EHR and other systems. But how do we do that? And how do we take the burden away from the patient and the physician and the medical staff and really the whole system? And it's been, the thing that we keep hearing is we shouldn't be clicking in the world that we're clicking anymore, right? So technology has been out there for a long time. Siri had $200 million spent of investment from MIT and government, et cetera, on technologies around communicating, and the technology has been out there. We're just not leveraging it in ways that can be advantageous. And so we're working on a lot of cool technologies in that space, and also thinking about new payment methods, right? What about cryptocurrency and how does that work, and blockchain technologies for you probably know the American Medical Association runs the CPT codes. How do you do CPT coding or ICD-10 next generation in 5 years' time? Well, why wouldn't you use that on a blockchain, right? Why wouldn't you use newer technologies that you could just call against? And that's what we're doing.
Okay, well, that takes us to healthcare value. So is this kind of what we're talking about, this whole shift to instead of pay for performance, pay for value, the macro MIPS CMS programs? Is that what we're addressing here with healthcare value?
Yeah, healthcare value is, so if a physician needs to spend kind of like $50,000 on technology to try and be relevant in the new world, how do you make that happen, right? So the price tag of healthcare globally is going up. We know that. People are getting older, populations are growing, etc. Right? With all of that it's not sustainable. It's just broken. And so you have a lot of money that's just wasted, right? And you get waste, right? Every industry has waste. But the waste is about how do we achieve the best value for money when you can compare things. And we have technologies like TrueCar and other things in other industries, right? And we can get comparisons. We don't get comparisons in healthcare, right? So we're working with big payers. We're working with analytical companies to try and expose some of the insights to actually the physicians and the patients and everybody. And that's pretty awesome.
You mentioned waste in healthcare. Let's talk about that a minute. Certainly, one example of that's often trotted out is duplication of tests. Maybe somebody has a chest X-ray and they need to rule out pneumonia, and they go to another doctor, and the X-ray is repeated. And sometimes there's a need to repeat the X-ray, but sometimes there's not. However, there's a financial advantage of doing 2 X-rays on the same day for whoever's doing those X-rays. And so aren't there some, in our complex system in the United States, that kind of duplicate testing can occur. Of course, one thing that might control it somewhat is a third-party insurance company or Medicare will only pay for a certain test, within some, and not be duplicated within some reasonable amount of time. You probably know more about that than me. But what are the kind of waste is in that? One of the things I thought Health 2047 was, I think it said it's we're spending $3 trillion a year on a $2 trillion situation. So at least a third of money to spend is wasted. So what are some of the examples that you see of waste that can be modified by technology? I hope that's a clear enough question to ask.
Absolutely. So some of the interesting things that, the car industry has learned to get rid of waste and just-in-time ordering and other things. We've seen instances of like vitamin bottles being prescribed and costing $15 when you can go down to Costco and buy them for $3. You can see, and you're buying them in small quantity, and it's triggered like that. So, the other aspects, just like you were saying, I had a car accident and I went for some neck X-rays and had to have follow-up neck X-rays, and if I did it in the ER, it was $1,500. If I did it outside the ER, it was $89. And so,
absolutely,
was it an ER situation or not? Who was paying for it or not? And the aspects of linking some of that care together is just phenomenal. I've actually had huge amount of tests done in the last couple of 8 weeks, as I was saying. What I found which really was really impressive is when you get the system to work together in a way that says, and this happened to me, you turn up to the doctor sits there and comes with a prognosis and sends you for some tests. And at the same time, it's triggering other events. And that's because we sat there and said, I did problem solving, and that's what I've done all my life. I'm a technologist, and I come from an engineering background, and that's what it's about. How do you do problem solving? And so we started analyzing between us the problem whilst I was in the doctor's surgery. What could it be? How could it be? And what should we do in the next week, right? So go and do these tests. And whilst you go and do those tests, I've got a meeting in the same building. I will go and check the test results in 3 hours' time, and I will contact you. You should maybe go to the cafe or whatever, wait there. I don't want to admit you, but don't do the following 5 things. And if this, and this happens, we should go and do this. Now, technology can do that, yeah? And I think the hardest thing is we don't have the if, there, when answers that computer technology, the way it's been developed in healthcare, can actually answer those questions for us in real world. And we've been reluctant to do the AI technology to do that, but we've been more wanting to do workflows. And we build single workflows that then can't be broken out into multi-steps and create different pathways. And so what we've looked at and what we spent a lot of time on is, if you build different pathways, and we're doing this massively with the IHMI stuff, why don't you build a data model that has 20 different ways to get out of this, but you can turn around and say, diabetes, yeah? And it says, hey, tell me about their blood sugar right now, tell me about, and it asks 3 or 4 questions. And once you ask those 3 or 4 questions, it can help you make informed decisions. And that's not putting a doctor down or a nurse down that they don't know what they're doing, but it's gathering all the other parts of the data from the system that they might not ever be able to see. And we've probably all seen it. You know, I've seen it with relatives and patients. You go in and you turn around and say, oh, no, they had that immunization, right? And they were about to give them another shot, and they've already got the needle out and everything else. So what do? They throw that away, right? And so you see things where, because the case was, you know, the hospital had a situation where a operating room was scheduled for an appointment. They've sterilized everything. They've got all the product out ready for it, and the patient actually got delayed because they were in traffic and they had to cancel the appointment. Right? Huge cost. Yeah. What if the patient didn't follow the steps to get ready for the operation? What if the healthcare organizations take 90 days to 180 days to get paid? Guess what? The prices go up. Right?
Sure.
What if you've now got duplication, like you were saying? So, you know, Charles, I need you to go and have more blood tests done, but I had those blood tests yesterday. Oh, you did? Okay, maybe we should do 3 other ones instead then. And it's not flagging you had those 3 yesterday. Yeah? What is the difference going to be between one day? And I think that's the hardest thing that technology today, the simplest aspects in a lot of this is, a lot of the technology we use, it's user interface. And what you take from learning with people like Boeing and other people is, when you look inside an airplane, they've tried to declutter it. They've tried to use for the pilots now very rapid fire information that is relevant when they need it. And the rest of the time, it closes down and doesn't give them anxiety about the information overflow. And that's really hard. And healthcare, everybody keeps saying it's about the amount of information I can get. Most of the time, the doctors and staff that we talk to are on information overload. Yeah, they're not getting the right information given to them, and so, you know, there's a lot of product that is bought that's not used, goes out of date. You know, cancelled situations, hospital events where you could have done things earlier, and we've seen instances where if we were put on a diabetes program, you might not or early enough or thought about certain situations in the future about controlling certain things, you might sit there and say, hey, in the future you might end up with kidney failure, renal failure, etc. And the cost burden then is, you know, 10x times what it could have been if we'd figured it out earlier. And that's because it's not gathering all these pieces together. And, you know, the end answer is we've become part of our own problem, which means we go to the ER a lot, and that's a big cost. We go to, you know, outpatients. What many doctors and many surgeons we've talked to literally have sat there and said, I only really need to see 20% of the patients that come through to me because they've been misdiagnosed or I've got the wrong information. 20%, can you believe that? 20%, right? So if you could increase the right people getting to the right care, yeah, the value cost return is phenomenal. And you've seen it with cancers and other things, so it's been pretty phenomenal.
Well, we only have about 3 more minutes, Charles, and let me kind of bring this into focus, because the comments that you just made about having the right information at the right time, or the important information, not necessarily all the information, and then having the right patient in front of you at the right time, not all the patients kind of coming through. I was at the HIMSS conference in Las Vegas last month, and used to be population management and interoperability were the big themes year after year. But this year, it was about artificial intelligence, machine learning, and blockchain technologies. Do you think that we're at a place where those really developing technologies are just the next step, or is this really a truly disruptive series of events that are taking place in front of us with these new technologies?
I think they're transformational. I think we've used the big data aspects for so many situations that people have not realized what it could actually do and how it's doing it. The way of distributing technology and distributing effects, the way that we change application technology and helps remove some of the silos, that's absolutely transformational. Cloud's done this in enterprise, and internet did this before all of this. And I think a lot of hype around blockchain, a lot of people hype it up. Blockchain is an amazing piece of technology from distributing content and creating a ledger-based platform and database that can be really used in the future. A lot of work to be done. We're early days on this. This is kind of like early days on the internet. And
Sure.
What you would have said back on the internet was, everybody looked at Amazon as, wow, maybe they won't be around in a couple of years' time. Now they're the biggest player in the block, and the effect can change in every industry aspect. This is about how do people get on board with this and use it and not just become a sales tool. And I think that's the hardest
Absolutely.
aspect. Getting things adopted is the hardest thing in healthcare.
These things are being used as sales tools right now, and you kind of have to look beyond the veil to see the real potential there. Charles, I can't believe it, but we've totally run out of time.
It's been amazing.
Thanks to our audience joining me on this episode of the Tate Chronicles. I offer a special salute to my guest, Charles Aunger. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors. Thanks a lot, Charles.
Thank you very much.